Good for plantar fasciitis. We use this in comparison. I always am curious as to how patients would respond to this technique versus the one that you guys just learned with the low-dye taping. Low-dye taping is a good and an effective method. Takes a little bit more time and takes a lot more tape. And this is also a technique that, with a little bit of practice, the patient can probably start to apply themselves. But it's basically, we're looking at externally rotating the calcaneus. So, right, everybody's looking like Eric is looking there. Rotating, what is that?
Just think about how you would externally rotate the tibia. Okay?
Right.
And
yeah.
Make the calcaneus do the same thing.
Exactly, pretty much. If you cut off, yeah. I mean that's the direction. That's the motion. If you imagine the anatomy coming down the calcaneus here and it ends right here, just lop off the front of her foot. To externally rotate the calcaneus, it's going to go that way. The distal end of the bone going out laterally. You can't help but get a little bit of frontal plane motion with this technique, which is good because we're trying to limit, just like with the low-dye taping, in my mind, we're trying to limit pronation a bit, and that's where you end up with a little bit of inversion at the calcaneus as well. So, to externally rotate the calcaneus, our first point of contact is going to be at the posterior aspect of the calcaneus and the lateral. Now that I'm on video, I can't rip the tape. Yeah, I know, right? Thank you. My old hands. But we're not going to go there today, Phil, right? Okay, now what I'll usually have patients do, first I line it up. I find this one I always have the hardest time getting the angle just right, because if you're too kind of flat with your angle, it's going to just come across the top of the foot. Where you want the tape to end up is more across the anterior tibia. So you want to go a little steeper of an angle, and then it'll wrap right around the top. You're again missing the Achilles tendon, if you can. And what I usually do with this is, instead of me trying to produce the correction, scoot towards me just a little. There you go. I'll have the patient, I'll just kind of stabilize it. And what I want you to do is turn your toes the other way. Nope, towards your, yeah, that's it. And then it'll come up around the top and over. And then we take another piece right on top of that. Okay, relax for a sec. There you go. Getting a pull on the tape. Go ahead and now pull. There you go. Just to kind of reinforce that motion. So you're getting an external rotation force and a little bit of an inversion force. And with patients with really flared up plantar fasciitis, especially ones that are extra sensitive right near the calcaneal tubercles, a really effective technique with a lot less tape. And that's it. That's calcaneal external rotation.
So you want to do the last? Can we just show the last
Yeah.
tape job?
Yeah. Let's do that. Again, the way that I think about it, the way that I find it's most effective to use, is in your patients that either have some shoulder impingement without any real apparent reason, some cervical pain, upper trap pain, tension headaches, anything that might be because of this sort of posture. And the taping technique obviously we're not drilling external fixators into his scapula, so the tape isn't really holding anything in position, but it's giving a lot of good proprioceptive feedback to his muscles. So I think it's a really good technique because it gives kind of a negative reminder, and then the patients actively use their muscles to hold themselves in the posture we want them to hold themselves in. And the posture we're talking about is more in the downward direction. So you're kind of bringing your shoulders down towards the floor and then tweak them back a little. And it's hard. You have to kind of have a lot of different cues in your bag because every patient's going to respond differently to different cues. Some people you'll say, yeah, we're going to bring your shoulders down and back, and they'll do this. Some patients we've said, pretend you've got a fish hook right into your sternum and your breastbone and lifting it up into the air, and kind of get into that position. There's a lot of different cues that you can use.
That's a weird one. Yeah. The helium balloon works too. Whatever.
Yeah, I used to work in the canning
People that are
plant.
into that stuff.
Yeah, right.
Isn't that weird?
Some people are into that.
No, I'm serious.
They
They
hang by the
hang themselves like high hooks.
Yeah, on their back and like this. Yeah. Look at Eric Swoon, he's doing it. Yeah, look at that. I'm holding on to it.
So the tape that I use, the technique we can use either white and brown tape, the McConnell tape. You can use just plain Kendall wet-proof tape. You can use Kinesio tape. I've had some success with it. But the idea is we're going to put them in the postural position we want them in and kind of tape their skin into that position. So then the idea is when they ultimately invariably go into the improper posture, the tape will pull on their skin and give them kind of a reminder, and you'll see how that works in a second. So we start right around just in front of the clavicle, and we're going to come down. It's going to ultimately look like a V. I've never done an X. I don't know why. I guess I'm more early part of the alphabet kind of guy.
The V.
Wow. Wow.
Come on, if I have to ask you guys really quickly, all right, what comes first, N or T?
N.
W or X?
L.
All right, let me give you a hard one. H or A?
A.
And there are times when I have,
We practice going backwards.
if you've got a patient who's really having a hard time getting their shoulders in the right posture, I've had other therapists come in to help, so I'll kind of glide them where I want them to be, and then the other therapists do some taping. So basically, it's the shoulders go down towards the floor, sweep them back a little. Get that one out of the way.
Taking care of it.
Pull it around. Oh, good little pull.
Sorry.
Just like that. So now, if you were to go and try and kind of slouch forward,
Yeah, just pull it.
right? You can feel it'll pull, and they'll have kind of a little proprioceptive reminder to kind of stay back. I mean, it can be very effective. I was telling Professor Klappus, a 14-year-old high school student, a girl who was very apprehensive about putting the tape. I said, I don't want to have everybody see the tape and this, and she was just very, as 14-year-old girls can get sometimes. But she was having so much impingement, shoulder pain. I put the tape on her, and she came back the next time begging me to put the tape back on because it was so effective. So it can really, really help, just that postural correction. And this is a really good technique to send somebody home with something that's going to, it's like your hands on them after they leave the clinic.
Yeah, turn around. So you see what make it across the shoulders. Badass.
Really easy one to do.
It can be very effective.
Yeah.
So a lot of patients,